Welcome to the Florida Payment Error Rate Measurement Program, which is also referred to as PERM training. During this training, our objectives are to provide you with an overview of the Payment Error Rate Measurement Program, or PERM. We will also share the findings of the Federal Fiscal Year 2011 sample, as well as help to prepare you as Florida Medicaid and Children's Health Insurance Program, or CHIP providers, for the upcoming medical records request for Federal Fiscal Year 2014. To provide you with a little history, let's talk about the Improper Payments Information Act, or IPIA, of 2002 under House Rule 4878. The IPIA requires federal government agencies to estimate their improper payments annually and identify those that may be susceptible to significant improper payments. They then require an estimate of the amount of the improper payments, which must be submitted to Congress, along with a report on the corrective actions an agency will be taking to reduce the improper payments. As a result of the IPIA Act, CMS developed the Payment Error Rate Measurement, or PERM program, to comply with the IPIA and related guidance issued by OMB. All states are required by the Centers for Medicaid and Medicare Services to participate in the PERM program. Along with the guidelines of the law, after each cycle year, the Office of Management and Budget, or OMB, under Congress, will request a PERM national error rate by November 15th annually, and it must be compiled in the Department of Health and Human Services Agency Financial Report. This report includes financial reporting of improper payments through both Medicaid and Medicare programs. Each yearly report can be viewed from the HHS's website at www.hhs.gov/AFR. The collaborative efforts of the Federal Review Contractor, the Federal Statistical Contractor, and CMS work to establish each state cycle national error rate under PERM. Each state cycle comprises of 17 states on a 3-year rotating basis. Florida is a Cycle 3 state. The PERM program measures improper payments in Medicaid and CHIP and produces error rates for each program. The error rates are based on reviews of fee-for-service, managed care, and eligibility components of Medicaid and CHIP in the fiscal year which is being reviewed. It is important to note that the error rate is not a fraud rate, but is a measurement of payments made that did not meet statutory, regulatory, or administrative requirements. Under this review, the fee-for-service reviews comprise of both medical and data processing reviews. Data processing, or what is often referred to as DP reviews, comprise reviews which will look into the state's MMIS system to verify claim or capitation payment in accordance to program handbook policies and fee schedules for specific dates of service, recipient eligibility during the date of service, as well as the provider's program enrollment status during the dates of service. When we talk about medical reviews, these comprise of requesting medical records from the performing provider to support services provided under the sample claims. There is no eligibility portion of PERM for this cycle year. CMS PERM will carry over Florida's 2011 eligibility error rate component when calculating the 2014 state-specific and national error rates. In lieu of this, cycle states are required to participate in a pilot study to do a mini eligibility review of sample cases where eligibility has been determined under the new Affordable Care Act eligibility requirements. The results of this sample will not be applied to the 2014 eligibility error rate component for state-specific and national error reporting. Let's take a look at the selected findings in the 2011 PERM review. In this review, we found no custodian of records on file for Medicaid providers who had closed their business. 2 2011 PERM medical review errors, MR1s, resulted because providers could not be located at the time of review and no custodian of records was listed on the file. In both cases, the state and review contractor were unable to obtain the medical records for the sample claim. As a result of these findings and the importance of accurate data, it is imperative that providers notify the Medicaid fiscal agent if it is closing its business. The notification must also include the provider's Medicaid ID and the effective date of the business closure. This is imperative information and must be reported accurately and timely. Another finding that was noted in the 2011 PERM review was one of a medical review error, or MR1, which resulted because a provider failed to update his current address on the Medicaid provider file in FEMIS and could not be located at the time of review. Had the provider reported a change of address, the medical review error could have been avoided. Let's talk about the importance of the change of address. On a provider file, the following 4 types of addresses may be housed and therefore used as review data. They are a service address, a pay-to address, the mail-to or correspondence address, and a home or corporate office address. To ensure accurate communication, including prompt payment for services rendered, providers must report address changes. If first-class mail to a provider's service address is returned, Medicaid will suspend claim payments to the provider or the provider's group for services rendered by that provider. If no corrective action has been taken after 90 days, the suspended claims will be denied. To report a change of address, the provider must obtain and complete the Medicaid Provider Change of Address Request Form from the secure area of the web portal or by calling the Medicaid Fiscal Agent's Provider Services Contact Center at 1-800-289-7799 and selecting option 4. Unfortunately, during the 2011 PERM review, we also discovered that there were a certain amount of Medicaid records that were not retained for the required amount of time. In accordance with Medicaid policy and proper record retention, policy requires that the provider must retain all medical and Medicaid-related records for a period of 5 years from the date of service to satisfy all necessary inquiries by the agency. Records retention and accuracy is a very important task for all Medicaid providers. Now let's talk about the types of records that must be retained. Medicaid requires that the following types of records, as appropriate for the type of service provided, must be retained, and you should note that this list is not all-inclusive. You must retain Medicaid claim forms and any documents that are attached, professional records such as appointment books, patient treatment plans, and physician referrals, as well as medical, dental, optometric, hearing, hospital, and other patient records. And remember, those records must be retained for a period of 5 years from the date of service. Also included in the types of records to be retained are copies of sterilization and hysterectomy consents, prior and post-authorization and service authorization information, prescription records, orders for laboratory tests and test results, X-ray, MRI, and CAT scan records, and business records, such as accounting ledgers, financial statements, invoices, inventory records, check registers, canceled checks, sales records, etc. Tax records, including purchase documentation, drug utilization reports by drug NDC, partnership records, patient counseling documentation, provider enrollment documentation, utilization review, and continued stay approvals for psychiatric or substance abuse inpatient stays. In the 2011 PERM medical review, there were also findings of insufficient or illegible recipient medical records which were submitted by a provider. This resulted in a MR2 medical review error because of the provider's failure to provide the necessary records for the dates of service on the sample claim. Let's talk a little bit about how you can avoid this situation. Always remember that the records must be accessible, legible, and comprehensible. One way to remember this is just to remember the acronym ALC. As the custodian of records, your role is critical and extremely important. There are a number of different types of media which can be used to store records. They can be kept on paper, magnetic material, film, or other media including electronic storage except as otherwise required by law or Medicaid requirements. You must also be aware that in order to qualify as a basis for reimbursement, the records must be signed and dated at the time of service, or otherwise attested to as appropriate to the media. Also, please note that in the case where rubber-stamped signatures are used, they must be initialed. Medicaid providers who maintain electronic records are required to implement a mechanism by which electronic records can be produced in a paper format within a reasonable time, upon request by the agency. This requirement is also extended to federal agencies and their contractors. Also, please remember that when providers sign and submit the Medicaid Provider Agreement, you agree by way of signature to retain all medical and Medicaid-related records for a period of 5 years to satisfy all necessary inquiries by the agency. Here we'll talk a little bit about how these guidelines are outlined in the law. In accordance with 409.907 and 409.913 of the Florida statutes, authorized state and federal agencies and their authorized representatives may audit or examine a provider or facility's Medicaid-related records, and this examination may include all records that the agency finds necessary to determine whether Medicaid payment amounts were or are due, and applies to the provider's records and records for which the provider is the custodian. The provider must give authorized state and federal agencies and their authorized representatives access to all Medicaid patient records and to other information that cannot be separated from Medicaid-related records. The provider must send, at his expense, legible copies of all Medicaid-related information to the authorized state and federal agencies and their authorized representatives upon request. Now let's talk about the portion of the law in regards to the right to review records. At the time of the request, all records must be provided regardless of the media format in which the original records are retained by the provider, and all medical records must be reproduced as paper copies unless otherwise authorized by the requester, regardless of the original format upon which they are stored. Under the requirements for medical records section of the law states that the medical records must state the necessity for and the extent of the services provided. The following requirements may vary according to the services rendered: the description of what was done during the visit, the history, and the physical assessment. In order for providers to maintain accurate records for their patients and to meet the requirements of the law, here are more details on what the medical records should include. The record should include the following: the chief complaint on each visit, diagnostic test and the results, a diagnosis, the resulting treatment plan, including any prescriptions for the patient, and also any medications, supplies, and scheduling frequency for follow-up or other services. The medical record should also include any progress reports or treatment rendered, and for each record, the author of each entry must be identified and must authenticate his entry by signature, written initials, or computer entry. The dates of service must be included as well as any referrals to any other services. You'll also note, for additional information, providers should refer to the Service-Specific Coverage and Limitations Handbook for record-keeping requirements that are specific to a particular service. In this section, we're going to talk about incomplete records and the result of those records. Providers who are not in compliance with the Medicaid documentation and record retention policies may be subject to administrative sanctions and recoupment of Medicaid payments. You should also know that according to Medicaid policy, any Medicaid services provided that lack the required documentation or appropriate signatures, those payments will be recouped. Procedures which have not been billed in accordance with policy stated in the Florida Medicaid Handbooks are considered incomplete. For example, one 2011 PERM medical review error, or MR3, resulted when a provider incorrectly billed the appropriate procedure code for diagnosed treatment per the current procedural terminology manual, or CPT. One 2011 PERM medical review error, or MR3, resulted when the provider billed the incorrect number of service units for the dates of service. We previously mentioned the Medicaid handbooks, so let's talk a bit more about them here. All Florida Medicaid providers should be knowledgeable about the 3 types of Florida Medicaid handbooks that exist. These handbooks contain many of the requirements for providers to remain compliant with the program's policies. The handbooks are essential for providers to ensure that they know where to find the policies that govern their practices and types of billing. First is the Provider General Handbook, which is relevant to all providers. Second is the Coverage and Limitations Handbook, which is specific to a particular provider type and service. This results in several different coverage and limitations handbooks, so make sure to obtain the correct one based on your provider type. And third are the Reimbursement Handbooks, which are also relative to the provider type, but specific to whether you are an institutional provider or a non-institutional provider. These handbooks address how to get paid. Here we'll talk briefly about each of the different types of handbooks. The Florida Medicaid Provider General Handbook applies to all Medicaid providers and offers information regarding the Florida Medicaid program, recipient eligibility, provider enrollment, fraud, and abuse policy, as well as resources which may be helpful to you. The Coverage and Limitations Handbook goes into detail on the covered services and policies for each type of Medicaid service. These manuals explain what the Medicaid program will pay for, and they also explain the policy limitations, exclusions, and procedure codes. The handbooks provide descriptions and instructions on how and when to complete forms that are required for particular services, and provide details about the program requirements documentation for particular services. Remember, a provider who furnishes more than one type of service will have more than one coverage and limitations handbook. And the last type of handbook we will talk about here is the Reimbursement Handbooks. The Reimbursement Handbook will provide you with the necessary guidance for billing the Medicaid program. Each Reimbursement Handbook is named for the claim form that it describes and explains how to complete and file claims for reimbursement of those particular services from Medicaid. It also contains generic eligibility information, general Medicaid information, and claim instructions. Please refer to the Reimbursement Handbook that refers to the specific claim type referenced by your specific program's handbook. As we continue, let's talk about the provider fee schedules. The current Medicaid provider fee schedules include the covered services codes and maximum fees for covered services. The schedules are provided to you in various formats, including PDF, Microsoft Excel, and ASCII delimited format or text format. For any procedures that are not listed on the provider's Medicaid fee schedule or procedure code table, these procedures and codes are considered as non-covered services. You may also download the Florida Medicaid fee schedules from the Medicaid Fiscal Agent's website at www.mymedicaid-florida.com. In this final section of the training, we'll talk about the 2014 Florida Payment Error Rate Measurement or PERM program. In Florida, for federal fiscal year 2014, CMS will measure the following elements. First, the Medicaid fee-for-service claim payments. Second, the managed care capitation and premium payments made on behalf of beneficiaries. And third, they will look for a measurement to estimate the level of error in its eligibility determinations for Medicaid and the Children's Health Insurance Program, or CHIP. CMS will use two national contractors to measure improper payments in Medicaid and CHIP. The first contractor, the Lewin Group, will provide statistical support to the program by selecting a sample of claims to be reviewed and then calculating Florida's error rate. The second contractor, A+ Government Solutions, will provide documentation and database support by collecting medical policies from the state and medical records from the providers, and they will also conduct medical and data processing reviews of the sample claims. What should you do if your claims are selected to be in the sample review? If a claim for a service that you rendered to either a Medicaid or CHIP recipient is selected to be in the sample, A+ Government Solutions will contact you for a copy of your medical records to support the medical review of that claim. Why do we need the records? The medical records will be needed for these reviews in order to determine if fee-for-service Medicaid and CHIP claims were correctly paid. You must submit the records in a timely manner, and you should know that from the date of contact, you must submit these medical records within 75 calendar days. Our goal for this training is to reach out to as many Medicaid providers as possible in an effort to reduce potential errors from provider noncompliance, and we hope you have found the information provided beneficial. Based on today's training, please remember that if you do not submit the requested supporting medical documentation, the claim will be coded as an error and any monies paid will be recouped. Also, since dollars estimated as being paid in error from the sample will be projected to the total claims, the actual impact of each claim error will be magnified several times, and this will result in an exponentially negative impact on the Florida Medicaid program. If the error rate is excessive, the agency may have to add controls or other limitations to address problem areas that are identified. Here are some helpful tips for a successful review. Always comply with any medical records request from the CMS contractor and remember to return them timely. Stay current with Medicaid policy by checking for Medicaid provider alerts regularly along with the quarterly published Medicaid bulletins for upcoming PERM-related information. And if your office is selected for medical records review, you will need to provide those as requested by A+ Government Solutions. This is a reminder to bill in accordance with the billing procedures outlined in the Provider General Handbook and within the Program Policy Handbook for the specific procedure being billed. Some questions you should ask before billing. Are the appropriate procedure codes being billed in accordance to the diagnosis given as defined in the CPT manual? Are the correct units of service being billed during the recipient's dates of service? Is your program's handbook policy being followed when billing and reversing a claim? is the proper level of care being billed for the service provided during the recipient's dates of service. If you have changed your address or telephone number and have not updated your information with the agency, this is a good opportunity to do so, as you are required to report any changes per the Provider General Handbook. Providers must promptly notify Medicaid of any change of address by obtaining and completing the Medicaid Provider Change of Address request from the secure area of the web portal, or by calling the Medicaid Fiscal Agent's Provider Services Contact Center at 1-800-289-7799 and selecting option 4. Before we end the training today, let's talk briefly about the provider's custodian of records. If you are closing out a former custodian, list the individual's name and the date they departed, and if you are adding a new custodian, list the individual's name, home address, date of birth, social security number, and whether they are the financial or medical custodian and the date they started. Please also remember that for the custodian of records, a background screening is required. You can view the background screening page under Enrollment on the Medicaid Public Web Portal for more information. Please visit the website http://ahca.myflorida.com/mchq/central services/background screening/index.shtml. As a provider, you will also need to be aware of your responsibility regarding notification to DCF regarding any change in a resident's Medicaid eligibility. Medicaid nursing home providers must notify DCF within 10 days of any changes which may affect a resident's eligibility, and some examples of factors affecting eligibility include discharge from the facility, temporary absence from the facility, and the death of the resident. Changes may be submitted via My Access account, faxing the client discharge and change notice form, which is Form CF-ES 2506, to 1-866-658-4135, or by phone to the Customer Call Center at 1-866-762-2237. A copy of this form may be obtained by going to http://www.dcf.state.fl.us/DCF forms/search/DCF form search.aspx. Enter CF-ES 2506 under the form number and then click Search. In recapping today's presentation, let's talk about possible problematic scenarios you can avoid. Here are a few scenarios which may result in negative outcomes. Not submitting medical records in the time frame specified by the PERM review contractor, insufficient documentation provided to the PERM review contractor, or not following Medicaid billing policy. Examples of this are noncompliance with policies referring to a change of address, and this is any of the aforementioned addresses, policies on record keeping, and billing specific to your program's handbook. For more information and resources, you can find all of the Florida Medicaid handbooks, fee schedules, forms, provider notices, and other important Medicaid information on the Medicaid Fiscal Agent's web portal at http://mymedicaid-florida.com. Also, the Florida Medicaid's web portal solution provides communication, data exchange, and self-service tools to the provider community. The web portal consists of both public and secure areas which require a username and password. The public area contains general information such as program awareness, notices, and forms. If you visit the CMS Payment Error Rate Measurement or PERM website, you will see this as their PERM homepage. You can visit the cms.gov website for PERM at http://www.cms.gov/research-data-and-system/monitoring-programs/perm/index.html. In order to become familiar with the Agency for Healthcare Administration's PERM website, please visit us at http://ahca.myflorida.com/Medicaid/PERM. If you have any questions, Please feel free to contact us via the contact information provided in this training and on the PERM page, and we appreciate you attending today's training.